clinical precision when it comes to the cost of healthcare. At Medica Centre in Sydney South, this dispensary ensures that only the exact amount of medical consumables is supplied for each surgery. Goods that track to each nurse, doctor and patient, providing deep, granular understanding of where costs lie.
We can capture every item that's used, from the smallest syringe through to the largest disposable laparoscopic piece of equipment. And what that allows me to do is capture the entire cost and compare that surgeon to surgeon. Using knee arthroscopies, for example, we've got quite a few orthopaedic surgeons that do knee arthroscopies. Across the board, one of our surgeons, our orthopaedic surgeons, will do a knee arthroscopy in 20 minutes. He'll use approximately $200 worth of consumables. Comparing that to another one of our surgeons, he can take anything up to an hour to actually perform the knee arthroscopy and uses up to $500 or $600 worth of consumables.
This is just a quick, cheap list to teach nurses.
It's a far cry from how most hospitals are run.
In public, it's basically non-existent, this sort of costing. In the private, it's semi-existent. The normal costs that you see associated with how we run a facility are worked out on per patient day, so medical consumables per patient day. Other facilities in other private hospitals and also public hospitals normally run between $250 and $300 per patient day on medical consumables. And everybody tries to work to that figure because that's what they believe and that's what they're told, because that's what you can visualise. When we started looking at, now that we have this system, we're actually seeing that medical consumables are pushing $400, $500, $600 a patient day, which is true data. So there is vast differences to seeing where your efficiencies lie with regards to your ordering, the amount of stock you keep on hand, and especially for us, just-in-time ordering.
And those gains are not just from good inventory management. Better scheduling and preparation of surgeries means that efficient doctors are favoured.
I would say we're probably increasing efficiencies in the hospital as a whole by, at this stage, 30 to 40%. And I'd use the orthopaedic surgeon that does our knee arthroscopies. When he first started with us, his time frame was 15 to 20 minutes between operating room turnover, and as I said before, he's down to 2 minutes between turnover now. And I mean, that just increases efficiencies for us exponentially. Less equipment, less time on the operating table means that I'm not paying for staff as much, and we're getting greater efficiency of the patients in and out.
As our population ages, eliminating costs is crucial if we are to avoid a health budget blowout. And according to a report by the OECD, Australia could reduce unit costs for common hospital procedures by 42% without affecting quality of care.
Are you going to have two teams on
For the founders of Medica Centre, that spells a huge opportunity.
Our view is that we're spending about $130 billion a year now, and up to 25% is totally wasted because of the bureaucratic structures and the fact that we're using old technology. There's been no serious investment in healthcare over the last 30 years, regardless of who's in power, to keep up to date. We've got great doctors, great nurses in Australia. We've got to give them great facilities in which to operate in.
Medica Centre hopes to generate 20% returns a year for the next 25 years with their state-of-the-art facilities. Of course, they can choose to perform high-value, low-complexity procedures. Public hospitals cannot. But simple tools like inventory management and better scheduling are long overdue in the hospital sector. Such an investment now will have serious long-term health benefits.